Kulsum International Hospital is 100-bedded tertiary care hospital providing services in cardiology, cardiac surgery and other specialties.
I am a US trained cardiologist and I finished my training there, 3 years in medicine and 3 years in cardiology back in 1983, and subsequently I did 10 years of practice which involved interventional and clinical cardiology in the US.
I am consultant hematologist and classified pathologist working as director of lab in Kulsum International Hospital, Islamabad.
My name is Dr. Faridullah Khan. I am professor of cardiac surgery and I do my private surgeries at Kulsum International Hospital.
Out of 100 beds, we have about 25 beds which are critical care beds.
It's a well-reputed hospital. It's situated in the heart of Islamabad and it's basically a cardiac setup.
Very strong CCU which is always full, and we have a medical ICU which is also run by our critical care specialist, and we have a cardiovascular ICU which is run by our cardiac surgeon along with his team of anesthesiologists, and we have a surgical ICU which is also managed by the general surgeon as well as the anesthesiologist.
We are performing the whole spectrum of the histopathology. Second is the microbiology department. We are looking after the microbiological samples from the patients as well as the outsourced labs.
And I do about 30 to 40 open heart surgeries per month, and we have very good track record, and probably we have the best cardiac surgery results in the whole country.
New cardiac surgeon who's coming is a very good vascular surgeon also, but he does a lot of endovascular devices like repairing aneurysms like AAAs and also doing peripheral vascular stenting. Right now we are doing carotid and peripheral vascular, but we'll expand more when he joins us.
The microbiology section is also having the virology section. We are performing the molecular virology for the hepatitis B, C and HIV. The NET screening and the molecular screening of the blood is also performed in the same department.
Patient care at KIH can be benchmarked with any regional or international standard.
We do about maybe 120 primary PCIs, and we are also planning on starting an acute stroke center.
We are providing the blood transfusion services for the hospital procedures, including the cabbage, and the routine blood bank services. Almost 150 bloods are and blood components are prepared a month, and we are screening for the hepatitis B, C, HIV. We are preparing the platelets as well as the fresh frozen plasma and cryoprecipitate from the blood components.
We have 24/7 emergency services, diagnostic services, as well as pharmacy services.
We do all sorts of open and closed heart surgery procedures. We have a dedicated cardiac OR and a dedicated cardiac surgery intensive care unit which comprises of about 6 beds, and we have a very qualified and trained staff which are working here round the clock to look after these patients.
Hopefully in the next 5 years we have a 250-bedded hospital along with a medical school, nursing school, dental school and a school of technology. So we feel that future is very bright for Kulsum Hospital, International Hospital, and the hospital was of course named after my late mother, because this building was also named after her. It was called Kulsum Plaza before it became the hospital.